Hello, my name's Tim Keogh. I'm working on the In Your Shoes programme here at ABMU. In Your Shoes is an opportunity for our patients to tell us what it's like in our care, to tell us what's good that we can keep doing more of, that we need to build on, and maybe some of the stuff that isn't so good from their perspective that we need to think about how we can do differently. It's also an opportunity for our staff just to take a moment to stop and listen to patients. Staff who come to these sessions have told us that it is actually really liberating and empowering just to have a couple of hours where you can just listen to patients' experience from their point of view, not to have to justify or defend or explain or solve issues even, just to sit and listen for a moment and understand from a patient's perspective what's it like in our care.
I think it's really important that we do listen to what the patients have to say, and I think this opportunity to open it up to members of the public to come in is really important. Because we have a lot of patient feedback, but to actually do it face to face brings a human element to it, which I think is really important at this time. I think it went really well today. From a staff perspective, really didn't know how this session was going to pan out, but it was just about listening to what the patient had to tell us, and just capture the information onto post-it notes as to what went really well and what we could do to improve. And I think, from that patient's perspective, she felt very safe in this type of environment and in her well-being for the way she was treated when she was in hospital. The positives, it was her focusing then on what the positives were, and then also what we could do to improve. And she said that she felt it really good to offload, I guess she said, in this controlled, safe environment, and that she hoped that her feedback would help to improve the patient care at the health board.
When members of staff and patients leave these sessions, at the end of the In Your Shoes sessions, I think they come in feeling a little bit nervous. Both groups come in feeling a little bit nervous. But when they leave, everybody leaves feeling, in fact, I was in a session, just come out of a session now, I asked people, well, how did that make you feel? And some of the colleagues said, well, that makes me feel hopeful. Hopeful that we can do something to build on the things that we're doing really well and to improve where, maybe we need to improve. I leave with a sense of hope. And patients, they leave saying just how powerful it is, just how positive it is, being listened to. Just somebody taking a moment to stop and listen. There are patients who've actually made complaints who've then come back in and said, if only somebody had taken the opportunity just to listen to me in that way, it never would have got this far. Hope and being listened to. So it's a positive outcome.